How can you hear your inner voice? What your inner voice tries to tell you is about your true self. Some call is about your spirit. How can you quiet all the outside noises and only tune in what your heart, what your authentic self is telling you? It is not easy, but it's trainable, and we can train it on the mat during our myofascial movement classes. Let's explore. Hi, my name is Ilkay and I'm your movement instructor. Come down on your back in a very comfortable position. Take a pillow for your head to support your head. If you want, you can bend your knees. Relax the arms down to your sides, however you feel comfortable. At this point, you can drop your knees in together and let's close your eyes. Relaxing your neck, your jaw, and your head. Take a nice and deep inhale all the way down to your feet, through your nose, through your spine, your legs, and your feet. On the exhale, imagine the air is moving all the way up to your nose from your feet. Again, breathing in, the air passes through your lungs, your organs, pelvis, your leg muscles, and your feet. And imagine the air is moving out through your nose from your feet, your legs, pelvic floor muscles, your organs, lungs, your throat, and your nose. Take a nice and deep inhale. On the exhale, let your body fully relax on your mat. Inhale, feel the lungs, maybe the whole body. On the exhale, as you relax, feel the gravity. One more time, inhale. On the exhale, let go. You can keep your eyes closed or open, however you feel comfortable. Take your hands on your pelvis. Feel the bones in the front. Feel how high these bones off your mat. You have the organs behind these bones and behind the muscle tissue, of course. And move the hands all the way up to your belly button. Feeling the belly button. Feel the height of your belly button from your mat. There are organs between your hands and your mat, underneath your belly button. Can you feel them? Can you sense the space around them? Move your hands to the rib cage. And now feel your lungs. Inhale towards your hands. Exhale and let it all out. Can you feel that your rib cage is moving as you inhale? On the exhale, can you feel the softness under your hands? Move your hands up to your heart. Place your hands on your heart. Breathe in and try to feel the heartbeat. Exhale, let it all out. One more deep breath. Inhale. Let it out. Move your hands to your neck. Wrap your neck with your hands. Feel your throat in the front, your neck muscles all around, underneath your palms and your fingers. When you inhale, can you feel the air is moving down through your throat, underneath your hands? Exhale and out. Inhale, feel the air in your hands. And out. Take one hand to your forehead, the other hand to the top of your head, and breathe in. This time, can you direct the breath up to your skull? Skull is a bone, but underneath you have an organ. And our skull is also have some movement capacity. Imagine you're breathing into the head, back of your eyes, and exhale, relax. Feel your face, top of your head, back of your head, and all out. Now open your arms out to the sides, a little lower than the shoulders. Turn your palms to the ceiling. Tune into your right leg and your left leg. Do you feel one leg is warmer than the other leg? Or one leg is colder than the other one? Tune into your feet. Are they cold? Warm? Same temperature? Different temperature? Which leg feels more alive? Move your focus up to your pelvis. Tune into the pelvic floor muscles. Pubic bone, tailbone, and between two sit bones, we have the pelvic floor area. And the pelvic floor area muscles carry the organ weight. Right now, because you're on your back, you're not carrying any of the organ's weight. Can you let go of the pelvic floor muscle engagement? Inhale to the pelvic floor. Exhale, let it out. From the pelvis, move your focus higher up around your belly. Feel the organs behind the abdominal wall. Can you feel the weight of your organs on your mat? Can you relax their tissue? Yes, all of our organs have an organ bag around them. Can you relax? Let your spine, your torso be really heavy. Move your focus up to your lungs and feel the space between the lungs and the lower organs. When you inhale, the diaphragm moves like a separator. It creates space when you inhale for the air, and on the exhale, it helps the air move out. Visualize this. In fascia language, we are focusing on the deep front line. And these muscle connections, together with their tissue, the fascial connections, are the most intimate connections that we have in our bodies. That connections are highly related to our emotions and our interoceptive senses. Let's have one more deep inhale. And on the exhale, relax your body fully on your mat. Now take your hands on your pelvis again. Feel the hip bones, ASIS bones. Slowly, with your hands, push these bones away from you, almost towards your feet, and let your muscles help you to do that. And on the next exhale, you're going to gently pull those bones towards the tips of your ribs and feel how the pelvis rolls backwards. Reach these ASIS bones away from you. Inhale. Exhale, roll back. Inhale, roll the pelvis away. Feel with your hands. Exhale, curl the pelvis towards you. Inhale, move the ASIS bones away from you. This time, open your right knee to the right side with your next exhale. Inhale, roll the ASIS bones up towards your rib cage. Exhale, carry the leg back to the center. Inhale, move the bones away from you onto your pelvic tilt. Exhale, open your left leg this time to the left side. Inhale, tilt the pelvis back. Exhale, close the left leg in. Inhale, move the pelvis again, the bones away from you. Keep going now, relax the arms to the sides. Exhale, open your right leg. Now you're not touching to the hip bones, but you're still feeling them. Exhale, tilt the pelvis back. Close the right leg in. Inhale, reach the pubic bone away from you onto your pelvic tilt. Exhale, open the left leg, rotate the pelvis to the left side. Tilt the pelvis back. Close your left leg in, bring your pelvis back to the center, and move the pubic bone away. Let the breath flow. Open the right leg. Roll the pelvis back towards you. Close. Roll the pelvis away from you. Left leg. Rotate. Tilt back. Center. Closing the left leg, reach the pubic bone away. Hold. Inhale here. Press your feet strongly down to the mat. Feel how that tilts the pelvis a little bit backwards. Pause here. Now visualize. Your spine is being lengthened through the lower portion. Imagine a warm water moving from the pelvis up to the lower back, up to the ribs, to your heart. Release the pressure off the feet. Move the pubic bone, your pelvis away from you like the way you did with your hands. Inhale. Now you're doing with the feet. Press the feet down. Imagine you're pushing your feet forward and away. Let the pelvis tilt backwards. Relaxing any excessive engagement around the glutes. Feel the warm water floating down towards the pelvis to the spine. Let go of the pressure. Center the pelvis. Reach the pubic bone away. Let's do one more time. Use the feet, push the pelvis, tilt the pelvis backwards. Holding it here. Feel the warm water. Press the feet a little stronger to take your pelvis just off the floor. Pose. Breathing in and out. Now the pelvis is off the floor. Let the breath flow. We said we have organs inside of your pelvis. Now the pelvic floor muscles are almost upright position. Not really, but the weight is not on the pelvic floor. And the organs, imagine that they are gliding like a tunnel towards your rib cage, from the pelvic floor up towards the rib cage, grounding your feet. Can you let this happen? Do you feel any restrictions around your abdominals? Can you let go of that abdominal restriction if you have? And breathe into the lower back area. Exhale, lower the lower back down, your pelvis down, and reach the pubic bone away. Inhale, pause. Exhale, tilt your pelvis. Let the organs move away from your pelvis. As you continue pressing the feet down, engaging the pelvic floor muscles, take your pelvis off the floor. Hold. Let the organs move away. Do you feel any restrictions around the abdominals? Did anyone tell you to suck your stomach in? Is that an habit for you? Is it really working for you? Do you really need to do that? Can you let go of that? Slowly lower your rib cage down, your pelvis down. Reach the pubic bone really away from you. Relax your back fully on your mat. Bring your feet together and bring your knees together. Slowly open your knees out to the sides and go to your end range. Don't push anything. Just let your knees easily open to the sides. Can you relax the pelvic floor muscles? Right now, through the inner thigh tissue, we are tensioning in a very positive way, tensioning the pelvic floor muscles, their tissue. And then now pull the pelvic floor muscles up, close your legs together. Inhale. Exhale, slowly open your legs out to the sides. Can you feel the inner thigh and the pelvic floor connection? Because fascially they are connected and they influence each other. The pelvic floor tension will affect my inner thighs, and if I have excessive tension on the inner thighs, that will have an effect on the pelvic floor as well. Inhale here, exhale, engage the pelvic floor and close your legs together again. One more time, open your knees, exhale. Fully relax, fully let go. Now move yourself, your pelvis side to side. Relaxing the pelvic area, your neck and your jaw. Let the breath flow. And then slowly close your legs together as you steady your rocking side to side motion. Separate your feet. Feel the bottom of your feet. Feel the warmth of your feet. Do you feel cold? Or is it warm? Inhale here. Exhale, posteriorly tilt your pelvis. Roll the pelvis towards you. Take the pelvis off the mat and hold. Still grounding your feet. Letting the organs move away from your pelvis. Your pelvis right now is not carrying the organ weight. It's on vacation. Yet it's still working to keep your to maintain your posterior tilt, but no organ weight, no pressure. So you can really engage them to use the muscles to keep the pelvis here in this position. Relax if you're feeling tension or too much grabbing around the posterior pelvic floor, around the anus, let go. And then slowly lower the lower back down, your pelvis down, and reach the pubic bone away. Inhale here. Adding on, exhale, tilt your pelvis. Taking the pelvis off the floor as high as you feel comfortable. If you feel grabbing through the anus, it is about the startle response. When we afraid of something, like when we hear a loud noise very suddenly, we go into that startle response posturally. But now we don't need to protect anything. You can let go. Holding the position. Now slowly open your right leg to the right side as you maintain the height of the pelvis. Slowly rotate your pelvis to the right. Press the left foot strongly. Reach the left inner thighs out. Bring your pelvis and your right leg back home. Now ground your right leg. Open your left leg. Rotate your pelvis to the left side. Feel the grounding of your right leg. Feel how strongly the right leg is carrying the weight of your left leg, your pelvis. And then slowly bring everything back to the center. Articulate, and can you melt down and reach the pubic bone away? Inhale here. Exhale, tilting the pelvis backwards. Reaching the sit bones towards the knees. Pubic bone up, pause. Now tune in. Which leg feels more alive? Open your left leg to the left side and rotate. As you rotate, can you imagine that your organs are also leaning towards the left side of your torso? The right leg is carrying the weight. Bring your pelvis to the center, closing the left leg in, center everything. Now ground your left leg. Rotate your right knee out. Open the right knee out. Rotate your pelvis to the right side. Imagine everything, all the weight of the organs sliding towards your right side. Can you feel that? Can you let this happen? Breathe in. On the exhale, slowly coming back. And articulate, go down. Bone by bone. Reach the pubic bone away. Center your upper body. Bring your feet together. Open your knees to the sides as you maintain the position of your pelvis. First of all, go all the way to the end range. And then exhale and lift your knees just off the end range. Imagine now this is your new end range. We don't want to go all the way. We will do 2 bounces, 1, 2, and then we close the knees together. Again, butterfly wings, bounce twice. 1, 2, close. 1, 2, close. 4, 5, 6, 7, 8, 9, hold, Breathing in, breathing out. Keep your legs together. Inhale here. On the exhale, engage the pelvic floor and your deep abdominals. As strong as necessary, as little as possible when we take the right leg up to a tabletop. Hold it here. Tune into your body. What does your body tell you right now? Where do you feel this tabletop position? Do you feel on your leg? On your hip flexors? Can you really use the pelvic floor muscles to carry the weight of this leg? And then bring the leg down, maintaining the 90-degree angle on the knee joint. So probably you will be landing a little bit away from where you picked it up. Let go of the pelvic floor muscles fully. Inhale. On the exhale, engage the pelvic floor muscles and your deep abdominals as much as necessary, but as little as possible to carry the left leg up to a tabletop position. Hold. How is this side feeling? Where is the weight? Do you feel your leg? The hip joint? Are you using the pelvic floor muscles to carry the weight of this leg? Slowly lower the left leg down. Let go of that pelvic floor engagement. Inhale. Relax the pelvic floor muscles fully. On the exhale, pull the pelvic floor muscles in and up. Now use them to take the left leg this time up to a tabletop position. Now this is the second round. Are you feeling any difference? Do you feel like you are more control of the pelvic floor muscles while carrying the weight of the left leg? And then slowly lower the left leg down. Let go of the pelvic floor muscles fully. Inhale. Exhale, pull in and up. And tabletop your right leg. Pause. Is the weight the same? How heavy your right leg is? Where is the feeling? And then slowly bring your right leg down. Inhale here. Let go of everything. Exhale, engage the pelvic floor and the deep abdominals. Tabletop your right leg. Hold it here. Now engage the pelvic floor muscles stronger. If you feel ready, tabletop your left leg. Lower your right leg down. Lower the left leg down. Now stretch the legs all the way out and go back in your mind. When I said, if you are ready, take the other leg up to tabletop, what did you do? Did you really tune in and check in your body if your body was ready to carry the weight of the left leg without feeling any restriction or discomfort around your lower back, maybe around the hip joint? Was that an auto-respond to my question, or did you really check in with yourself? Do you think someone is expecting you to carry weight of your legs, both of the legs? Or were you true to yourself and saying that, maybe I'm not ready right now. I don't feel ready right now. I will carry one leg. Just tune in with yourself. Breathe in. No judgments, we are just observing. Bend your knees again. Inhale here. On the exhale, engage the pelvic floor and your deep abdominals. Tabletop your left leg. Keep the left leg here in tabletop. And if you're ready, if your body is ready to carry the weight of the other leg through the engagement of the pelvic floor, Let's do that. Lower the left leg down, lower the right leg down. What was your response this time? How did you feel? Did you carry both of your legs because you were ready? Or did you do it because you think you're supposed to carry both of your legs because it's just easy in your mind? Are you making your mind dictate your body? Or are you really listening, trying to hear what your body is saying? Inhale, ground your feet. Exhale, tilt your pelvis. Articulate and lift the pelvis off the mat. Let the organs move away from your pelvis. Let's lengthen your sit bones towards the knees. And if this is feeling comfortable, go higher. If you feel any grabbing through the posterior pelvic floor muscles, lower yourself a little down and try to relax that grabbing. If you're okay, if there's no grabbing, keep lifting the pelvis up. And again, tune into your response. What is your decision? And that decision is a result of tuning in, or it is the result of what your mind tells you what you're supposed to do. Push your feet forward and away, and then slowly articulate, going down bone by bone. Reach the pubic bone away. Bring your feet closer together and your knees together. Open your knees out to the sides, maybe halfway. And this time we will do 5 butterfly wings. Exhale. Inhale, close. Relax. Now separate your feet, mat width apart. Grounding your feet, tilting your pelvis backwards, articulating and lifting your hips off the floor. As high as you feel comfortable, as high as you don't feel grabbing through the posterior pelvic floor muscles. Open your knees to the sides, roll the feet out towards the pinky side. Now your glutes are working. Bring your feet to parallel. Now your hamstrings are working. Turn the knees in as you maintain the height of your pelvis. Now this is the inner thighs. Again, open the knees to the sides all the way. Feel how the glutes are working. Bring your legs to parallel. Your hamstrings are working. And turn the knees in. Let the inner thighs work. Keep your knees together. Articulate going down, bone by bone. Reach the pubic bone away. Walk your feet in. Inhale here. On the exhale, engage the pelvic floor and your deep abdominals as much as necessary, as little as possible, to carry the weight of the left leg up to a tabletop. Pause here. Keep the left leg here, and if you feel ready to carry the weight of the right leg too, engage stronger and take the right leg up to a tabletop. Bring your left leg down. Bring your right leg down. Relax the pelvic floor muscles fully. Inhale here. On the exhale, engage the pelvic floor muscles and tabletop the right leg. If you're not ready to pick up the left leg, engage the pelvic floor stronger and maybe take the heel of the left leg off the mat. And then when you practice this couple of times, as long as much as you need to, then slowly start practicing taking the other leg up to tabletop. Bring your right leg down and then your left leg down. Walk your feet closer to you. Inhale here. On the exhale, press the feet down, tilt the pelvis, roll the pelvis off your mat. Hold. Let the organs move towards the rib cage. Keep pressing your feet down. Keep tilting the pelvis down as high as you don't feel grabbing through the posterior pelvic floor muscles. Inhale and take the arms up to the ceiling, then slowly reach the arms overhead. Breathe in again to the lower back. On the exhale, tilting your pelvis and slowly articulating and coming down bone by bone. Lifting the arms up and then bring the arms down to the sides. Again, engage the pelvic floor and your deep abdominals posteriorly, tilting your pelvis, rolling the pelvis off the mat. Pause. Feel the grounding of your feet. Reach the sit bones towards the knees. And exhale, lift the arms up. Reach overhead. Inhale, pause. Exhale, melt. Carry the arms up to the ceiling. Tabletop one leg, engaging the pelvic floor and deep abdominals. Take that hand behind the knee. And then take the other leg up to a tabletop position. Bend your knees towards your chest. Open your elbows wide out to the sides. Press your legs into your hands. Nod the chin. Lift the head and shoulders up. And then rock back and forth. When you feel ready, bring yourself up onto your sit bones. Sit up tall. Cross your legs in front of you. If you need support, you can always use yoga blocks under your pelvis. Relaxing the arms on your knees, elongating the spine. Take your right hand and close your right nostril. Breathe in through your left side all the way to the face, your neck, your left lung, and down to the left side of your pelvis. And exhale through the left side. Change hands. Take your left hand and breathe in through your right nostril, face, neck, your right lung, lower back maybe, and your pelvis. And exhale through your right nostril. Changing hands again. Breathe in through the left. Breathe out. Change hands. Breathe in. And breathe out. Now change hands again. Breathe in. Close both sides. Holding your breath. And open the right side and breathe out through the right. Change hands. Breathe in through the right side. Close both. Hold your breath. and breathe out through the left. Change hands, breathe in through the left. Close both, hold your breath. Breathe out through your right nostril. Let's add some movement to this. Breathing in, growing taller. Breathe out, reach the arms forward and up, arm arc. Inhale, open your arms out to the sides. Exhale, lower your right arm down, take your left arm up, and nice side bend. Take your right hand and close the right side of your nose. Breathe in through your left side of your nose, all the way down to your left sit bone. On the exhale, move the arm first and bring yourself back to the center. Inhale, grow taller. Exhale, reach the arms forward and up, arm arc. Inhale, open your arms into a T. Exhale, lower your left arm down, take your right arm up, ground your right sit bone, close the left side, breathe in. And slowly lower the arm, exhale, let the spine follow your arm. Let's do one more time for each side. Exhale, arms up. Inhale, T. Exhale, side bend towards your right. Let the left side carry you against gravity. Breathe in. Now hold your breath. Exhale, move the arm and carry the upper body. Inhale, grow taller. Exhale, arms up into a T. Inhale. Take your left hand, close the left side, breathe in through your right. Hold your breath. Move the arm down and coming up. Reach the arms in front, shift the body weight forwards on your all fours. Your spine is parallel to the floor. Your hands are parallel, fingers are open, elongating through the crown of the head and the sit bone. Feel the sit bones, pull them down towards the knees. Engage the pelvic floor and your deep abdominals, rounding your pelvis into a posterior tilt. Rounding your lower back, upper back. Let the head relax. Breathe into the lower back. Exhale, use the arms. Push the body weight back. Feel how that tensions your lower back. When I push the body weight, I'm not pushing all the way, only halfway. Let go of the curl. Reach the pubic bone to the back wall. Reach the crown of the head and your sternum to the front wall and come into a flat back position. Use the arms to pull the body weight forward again. Inhale here, ground the pinky sides of your hands. Exhale, tilting the pelvis, pulling the sit bones down. Let your lower back follow. Let your thoracic spine follow. Let your head hang. Breathe into the lower back. Use the arms, push the body weight back halfway. Feel how that opens the lower back. Let go. Stay shifted back. reach the crown of the head, shifting the weight forward. Let's do one more time. Posteriorly tilting your pelvis through as you exhale. Breathe into the lower back. Use the arms to push the body weight back. Inhale, lengthen. Exhale, shift forward. Maintain the position. Slide your right leg back. Use the hands to shift the body weight back. Maintain the square hips. The spine stays long and flat. Press your left shin bone down as you lift the right leg up. Lower down. Press the left shin bone down. Take the right leg up. Lower down. 3, 4, one more, 5, hold. Shift the weight forward, rotating your left foot in, bend your right knee behind the left knee, and then shifting the weight back. Separate your sit bones, shift the weight forward. Keep your neck long, shift the body weight back. Reach the sit bones to the back wall, shifting the weight forward. One more time, shifting back, and then slowly walk the hands back. Bring your sit bones down and relax. Reaching the arms forward and up, arm arc. Open your arms into a T. Bring your right arm down, take your left arm up, nice side bend. Can you direct your breath to the left side of your body, to the left lung? On the exhale, move the arm. Let the spine follow. Inhale, grow taller. Exhale, arms forward and up. Inhale, arms into a T. Exhale, left arm down, right arm up. Breathe into the right lung. Exhale, move the arm first. Let your spine follow. Let your upper body follow. Shift the body weight forward. Stretch your right leg back. Turn your left leg into a parallel position. Bend your right knee under your hip joint. Inhale, feel the length of your spine. Exhale, tilting the pelvis posteriorly. Do you feel any difference between the right side and the left side? We did some changes to the left hip joint. How does it feel? Breathe into the lower back. Use the arms to push the body weight back. Let your lower back open. Let go. Reach the tailbone and the sit bones to the back wall. Your sternum to the front and the crown of the head to the front wall. Use the arms to shift the body weight forward. Again, tilting the pelvis. Tailbone to the pubic bone, engaging the pelvic floor and the deep abdominals. Let the head hang. Breathe into the lower back. Exhale, shifting the body weight back, using the arms. Inhale, let go of the curl. Find the length. Exhale, shifting the weight forward. Slide your left leg up, back this time. Shift the body weight back. Ground your right shin bone. Maintain the length through your rib cage and your neck. On the exhale, lift the leg. 5, 4, 3, 2, 1. Hold. turn your right leg towards the left, external rotation, bending your left knee behind the right knee, shift the body weight back, reaching the sit bones to the back wall, shift the body weight forwards. Again, reach the sit bones to the back wall, shifting the body weight back, feel the opening, shifting the body weight forward. One more time, reach the sit bones to the back wall, and then slowly bring yourself down, arriving. Grounding both sit bones. Grow taller and inhale here. Exhale, reach the arms forward and up, arm arc. Inhale, open your arms into a T. Exhale, lower your left arm down, lift the right arm up. Now inhale to the right lung. And on the exhale, move the right arm to the side. Like a domino, the spine follows. Inhale, growing. Exhale, reach the arms forward and up. Inhale, open your arms into a T. Exhale, lower one arm down, the left arm up. Long side bend. The left side is carrying you against gravity. Now you will direct the breath to the left lung. Feel the left lung balloon. And on the exhale, you're going to move the arm to the side. Like a domino, the spine follows, growing taller. Shifting the weight forwards on your hands. Reach your left leg back, tuck your toes under. Turn your right leg parallel. And then bring the left leg underneath you. Exhale, tilting the pelvis. Pull the pelvic floor muscles up. Let your lower back round. Let your back round. Let the head hang. Use the arms to push the body weight back. Let your lower back open further. Let go of the curl and reach the sit bones to the back wall. Your sternum and the crown of the head to the front wall. Using the arms, pull the body weight forward. Again, tailbone to the pubic bone to the breastbone, posteriorly tilting the pelvis. Feel how that opens the lower back. Breathe into the lower back. Use the hands to shift the body weight back. Let the lower back open. Now let go, reach the pubic bone to the back wall, finding the flat back position, and then we shift the weight forwards. Slide one leg back, tuck your toes under, keep the knee joint fully extended. Pull the hands apart as a sense to stabilize your scapula on the back of the rib cage. Stretch the other leg back, pause. Use the arms, your hands, to push the body weight back. Hold it here. Now the pelvis is again not carrying the organ weight. Can you let your organs move away from your pelvis up towards the rib cage in this active resting position? Breathing in and out. Reach the heels to the back wall. Posteriorly tilt your pelvis and shift the body weight only halfway forwards. Just halfway, don't go all the way. Use the arms to push the body weight back. Bend the knees and reach the sit bones to the back wall. Extending the legs again. Active resting. You're upside down right now. How does it feel? Your pelvic floor muscles are not carrying any organ weight. Is this tiring? Is it getting warmer? your room. Breathe into the lower back. Exhale, tailbone to the pubic bone to the breastbone. Shifting the body weight only halfway forward. Pause. Push back. As you find your flat back, again bend your knees, lift the heels. Extend the knees, lower the heels. Hold. Is it getting tiring now? Maybe for your arms. Maybe for your whole body is getting tired. What is the emotion? How do you feel? What is your body telling you? Is your body asking you to go down? Stop this. That's an interoceptive feeling. But what is your mind telling you? Does your mind dictating you to maintain the position? Maybe you're feeling discomfort on some of the joints. How do you decide what to do next? Is it me? Are you listening to your body? No one can know your body better than you. Big wave now. Heels, pelvis. Shift the body weight forwards. All the way. Find the flat back. Bend one knee down. Bend the other knee down. Untuck your toes. Shift the body weight back. Child's pose. Unload the arms. You can bring your hands under your forehead, or you can keep the arms fully extended, however you feel comfortable. Let go. Your neck, your jaw. Relax the pelvic floor muscles. Feel your sit bones are lengthening down towards your feet. Breathing in, breathing out. Now direct the breath to the back of your lungs. Let go. Breathe in and out. Slowly press the shin bones down. Lengthen your sit bones. Articulate yourself, your spine, onto this low kneeling position. Have a seat. Cross your legs in front of you. Reach the arms forward and up, arm arc. Open your arms into a T. Bring your left arm down, take your right arm up as you ground your right sit bone down to the floor. Inhale to your right side. Bring your right arm in front of you. Let your right arm rotate your rib cage towards your left, your sternum. Your neck also rotates, your head. Give yourself a little push with your left hand so that you can deepen this rotation. Now maintain where you are. Release the pressure. Take your right arm up, over, and slowly bring the right arm down to the side. Let the spine follow like a domino. Exhale, reach the arms forward and up. Inhale into a T. Exhale, lower one arm down, take the other arm up. Ground your left sit bone, breathe into the left side of your body. Take the left arm in front of you. Let your left arm rotate you towards your right side. Keep the arm bone centered in the shoulder joint. Give yourself a little push with your right hand. Deepen this rotation. Release the push. Maintain the position. Inhale, reaching up and over with the left hand. And then slowly bring the arm down, your rib cage, your neck, and the whole upper body. Reach the arms forward and up, arm arc. Open your arms into a T. Exhale, turn the palms down, tilt your pelvis backwards, bring the arms in front of you, lifting the arms up as you bring your pelvis to the center. Lift your heart, lift your chest, center. Lower the arms all the way down. That's it for today. I hope you enjoyed. Try to start questioning your decisions, why you're making that specific decision. Is it because everybody is expecting you to do so? Or are you true to yourself? I will see you in the next video.